Health Organization, where we have ministers of health and other stakeholders in the world of health coming together in Geneva to set the agenda for the coming year on public health. Today I have three lovely guests with me, and we're going to speak about how WHO delivers healthcare in places where there is active conflict. Um, Before I introduce the guests to you, I'd like to remind you that you can ask questions to our guests by using the hashtag AskWHO on Twitter, on Facebook, and on YouTube. So do send in your questions for our guests. I'm going to start from my right. We have Dr. Teresa Zaccaria, who's officer in charge at WHO for humanitarian interventions. Next to her, we have Andrea King, who is technical officer with the Global Health Cluster. And to my left, I have Dr. Burema Sambo, who is WHO's representative to the Democratic Republic of the Congo. So we have a wide variety of expertise here, very interesting people to talk about this topic. I am Shagun Khare. I work with the Department of Communications. I'm a communications officer, and I too focus on emergencies. Health emergencies can take many shapes and forms. You have pandemics, you have epidemics, you have disasters, but you also have conflict. And today we're going to talk about how conflict affects people's health, people's lives. While we wait for your questions to come in, I am going to pose a question each to our guests, and I'd like to start with Dr. Teresa. But before I do that, I'd, again, just for good measure, like to remind you that you can send in your questions with the hashtag AskWHO. I have my phone here, and my colleagues are collecting your questions, so as soon as they come in, I will be able to see them. So Teresa, let me ask you, as of today, WHO is responding to 44 health emergencies. How many of those are related to conflict?
Thank you very much, Shagun, and it's a great opportunity to be here to speak about a very important issue. It's true that millions of people are extremely vulnerable to not being able to access health services that they really need to survive, and it's happening in just too many countries. So right now, WHO is responding to 44 graded emergencies. It means that these emergencies are of a scale and complexity that are quite important for us to really respond to adequately as an organization. And among those graded, there are 16 that are categorized at the highest level by the organization. So they're either acute or protracted grade 3 emergencies. So just the highest in terms of complexity, impact on population's health. Now, 16 great emergencies, there are 12 that are related to humanitarian emergencies, 11 related to conflict. So even as an organization, and we saw how the world was severely impacted by COVID as a pandemic, but actually we're moving more and more towards responding to so many prolonged conflict. And that's really important to highlight that conflict are extremely complex. It's difficult to really address the root causes of conflict, and so they tend to go on for a very long time. And at the moment, across the world, there are 292 million people in need of humanitarian assistance across the world, mostly in 29 countries, with refugee flows into 41 additional ones. So I'm Indonesian, 292 million, that means equivalent to the entire population of my country in need of humanitarian assistance. So just that scale is quite scary, actually.
Thank you, Teresa. Impressive numbers. I have a feeling we're going to hear a lot of numbers today, but we would like to break down what that really means. So I'll ask you some more questions on that. But let me come to Andrea. Andrea, you were in Gaza very recently. And I know I overheard you speaking to a colleague about how impactful that experience has been for all of you who have been there. Using Gaza as an example, how do we work with different health partners on the ground, and how does WHO coordinate this work which involves so many actors?
Thank you, Shagun. WHO has several responsibilities. It's one, the cluster lead agency. It has a responsibility and accountability to lead the health response, and it's also the provider of last resort. In Gaza, we have a dedicated health cluster coordinator, and the idea is really to bring together the partnership to deliver a humanitarian health response. What does that mean? I'll have to throw out a few numbers again, where in Gaza we have 61 health partners responding to the humanitarian health needs due to the crisis. What is a partner? A partner could be a local or a national NGO, of which we have several already established in Gaza, or it could be an international non-governmental organization with expertise in providing health in an acute crisis setting. As the health cluster, we bring all those people together and make sure that a comprehensive package that is agreed upon by everyone is delivered in terms of health services. So for the children that require their medication for diabetes but have had to flee their home, or for the mother that is due to give birth in 2 weeks but the hospital where she was due to deliver has been destroyed, we make sure that these health partners provide the human resources, the medical supplies, and a safe space for whatever that is worth at the moment in Gaza to deliver safe patient care.
Thank you, Andrea. It's very meaningful work, but also clearly very challenging and very high impact work. Thank you. Just to keep the conversation going, I'm going to turn to Dr. Sambo next. Dr. Sambo, the country that you're currently working in, where you head the WHO office, the Democratic Republic of the Congo, has what has been described as one of the longest lasting and most complex crises in the world, most complex conflicts in the world, actually. I think we could take a whole hour just to talk about that, but since we don't have that time, could you tell us what has been happening in the last months in the country?
No, thank you for the opportunity. Just to talk about the Democratic Republic of the Congo, just to let you know, it's a country of 2,345,000 square kilometers, close to 120. This is close to the size of Europe. It's about 120 million people. It has nine neighboring countries. So if you add DRC and its 9 neighboring countries, we're going to make 10 countries. And when it comes to, you said outbreak are multifaceted. Yes, in DRC you have it all. You have man-made, you have natural disasters. On the man-made, we have war going to in the eastern part of the country, and the government fighting what we call the M23. We have intercommunal fighting in almost many of our provinces. We have flooding, we have landslides, and when you talk about those things, the consequences or the immediate consequences is putting people in the street or in the bushes. That's what you call the internally displaced people. We have more than 7 million people internally displaced in DRC. When it comes to outbreak and epidemics, you name it, we have it. Going from monkeypox to cholera to measles to anthrax to polio. So we are really at the same time fighting close to 10 outbreak and epidemics. We have flooding. I just mentioned flooding just a while ago. DRC has 26 provinces, 18 of those were affected, and close to 2.3 million people were affected by the flooding. When it comes to our health indicators, we have one of the most dramatic health indicators, even talking about what is going on now is like a high mortality, maternal mortality ratio. But to end this introduction, is just also to say DRC has been battling with the prevention and response to sexual exploitation and abuse. Whenever you have humanitarian crisis and you have many humanitarian actors, unfortunately, those humanitarian workers sometimes behave in the way that a health professional or any human being should not behave. So this also is another issue, and WHO is actually tackling that.
Thank you, WR. So that again, I think the theme that's emerging is the complexity of what happens in conflicts and the high stakes nature. While we wait for questions, I again repeat, it's Ask WHO. We're on X and YouTube. Those are the two platforms that you can drop your questions in. I'm going to stick with this theme of complexity. And maybe I'll again go back to Teresa, and I'll ask you, Teresa, how do we focus, how do we decide what to act on in such a complex environment?
Thank you. That's a very important question. The principle is that everyone who needs access to healthcare should be provided with that access. What happens in conflicts is the fall down of either the health system that is able to provide normally, able to provide services to people, but also just the health status of people that are directly impacted by conflict. It could be because of injuries, it could be because of diseases, it could be because people don't have access to vaccination anymore. So what is extremely important at the beginning, at the onset of a conflict, or when a conflict changes dynamics, is for us to do a proper risk assessment. We need to be able to quantify and qualify the various health problems faced by people. And the complexity of conflict is that every population, every individual will react differently to the ongoing conflict. And so that needs to be as precise as possible so that we can plan, we can respond accordingly. So in conflict, there's no such thing as blanket measure or intervention. Everything always needs to be adapted, and furthermore adapted to the context. Operations can be extremely challenging, but also very different. The context of our operations in Gaza is very different than the context of our operations in the Congo, but also in the Sahel region, for example, and so on and so forth. So that contextualization of our own knowledge of public health is extremely important and needs to match what we know are directly impacting people's health. And then, of course, there's the issue of accessing population who are in need of health services. And in conflict, it's even more complicated just because of the nature of the emergency itself. So this is where our partnership with so many different organizations is really critical to make sure that collectively we can have a better outreach and can access more people even.
Thank you, Teresa. Very, very interesting points. It's leading me to two questions. One is to WR, just that what I hear from Teresa's context matters so much is the knowledge at the country level, at the subnational level, the local knowledge. So could you tell us a little bit about our office in the Democratic Republic of Congo? How many people are we? How does it operate? Could you just describe the way we operate in the country?
Yes, thank you. The WHO main office is in Kinshasa. This is the capital of DRC. We have 9 sub-offices across our provinces, and we have 2 antennas, make it 11. So DRC has 26 provinces, meaning that some of our sub-offices take care of more than 1 provinces. So some of them 2, others 3 to 4 provinces. We have about 659 people working in WHO, for WHO in DRC. You may think it's too high, but no. I didn't give you the details of the outbreak we have, but just to give you a few. Just this year alone, we had more than 16,000 cases of cholera with more than 250 deaths. In measles, we have close to 47,000 cases with 1,100 deaths. For monkeypox, we have more than 7,000 cases with 354 deaths, making a case fatality ratio of more than 5%. We have flooding, we have internally displaced people, as I said, we have returnees, that's why we have also refugees, and we have a global total number of people in need in DRC is about more than 25 million. And the people in need for help is close to 20 million people. So these are not only statistics, these are people around behind these numbers. So we have equipped or the resources we have, we do not keep them in Kinshasa. We make sure that we have workforce in all the 26 provinces in DRC. We position kits that's mainly for emergency kits to be able to save more lives. Because with all this situation, you will ask how WHO is dealing to deliver. Yes, WHO is delivering, because when we see how many people we are able to reach with WHO interventions is amazing. To see how our workforce of less than 700 people across this continent, because the continent, I told you, the land size of DRC is 2,345,000 square kilometers, but we have been able to cover all the 26 provinces, all the 516 health zones, that districts, and our people are doing their best really to prevent and save life. So the work, I cannot say it's easy, it's difficult, but it's really where we can see WHO can deliver and make impacts on vulnerable people in the ground. Really, I will say to transform people, to save life, really.
Good to hear, WR, about the impact of our work. And maybe I'll ask the same question to Andrea, just to keep this flow of conversation. What is the impact that you feel most proud about, or what is the moment when you feel this is why we do the job that we do?
Thank you, Shagun. Honestly, it's the full impact can only be seen when you understand that the partnership comes together, upholding principles of partnership to a single aim, which is to relieve suffering and save lives. So there are those small moments of hope when you have a field hospital that may have been established in order to serve patients, and a child is born safe and healthy, and you know that the mother and child will both be cared for successfully in that location. And that is because a huge piece of work has been done by the partners to bring that capacity into country, which is a huge logistical challenge. And apart from the nurses and the doctors, you have a whole machinery of people that are behind that. There are logisticians, there are human resource personnel, making that the right people are employed to deliver those services. So although it's a massive effort, there are moments of hope when you see a life saved. Sticking with the theme of children, nutrition stabilization centers are one where within 4 days you can see a child on the brink of death really come back alive, smile, and have a round, happy face, not of edema, but of life and vigor. And that is the true testament to the work that all the partners bring together in their response.
Thank you, Andrea. That is true, that even in the midst of all this darkness, there is, a glimmer of hope and a glimmer of optimism in the work that we do, that when it pays off, as